we go. Dr. Stephan Esser, start that over. Dr. Stephan Esser, welcome to the Urban Pharmacy Podcast, my friend.
It's my pleasure. Thanks for the invite.
Super, super excited to have you on this morning. I usually start the conversation off with an icebreaker, and we're going to do that right now. It's 7 a.m. on a Saturday morning. I don't know if you've eaten or not. I do the early morning eating. That's my way of living. What's your favorite food right now? Currently in this day in life, what's your current favorite food?
Pineapple. Hands down. I'm in love with pineapples these days.
It's literally like right there in front of your camera.
I brought it just in case we were going to talk about food.
That is so funny. And I actually think that maybe you've done an Instagram filter with a pineapple. I know you've done a banana and a potato, which have been absolutely hilarious. And they are just so funny. But pineapples are amazing too. Oh gosh, there's so many amazing benefits. Okay, so do you like the whole fruit or are you like the juice? I mean,
I like all of it. I mean, so growing up as a kid, we just only had it rarely because it was expensive, or if we grew it, because I grew up in South Florida, and so we'd have it just as slices with breakfast. That was about all we did with it. But now that I'm older and we have a little wider access to pineapple recently, it's like we're chopping on a salad. I'm putting it in the smoothies every morning. I'm making like a sherbet out of it, and for desserts, I'm having slices of snacks. I'm having it, it's everywhere. And obviously, like you said, it's loaded with water, with fiber, with vitamin C, with, beta carotene, with bromelain, which is potent anti-inflammatory. I mean, the list goes on. So it's kind of like sweet, juicy, a little sassy, tangy. I mean, what's not to like, right? Yes. And health promoting. So yeah.
Yes. So good. And that reminds me of when we went to Kauai. There are these we went to this Sugarloaf pineapple farm, and there were these white pineapples, and just so epic. So good. And us as farmers actually spoke with the farmer who owned it and was like, he's ready to retire. And we were like, do you need somebody to buy the farm? Because like we could live on pineapple for the rest of our life. Like, this would be amazing. Okay. So pineapple it is. Okay. So that brings me to my next thought here. My next question, Stephan, you are an amazing eater. You eat super optimally, and you grew up this way. I was reading your bio. You're a 4th generation plant-based eater. Like, where did this all come from? How did you even get so lucky to live from birth to now, knowing what you know and eating the way that you eat?
Yeah, fortunately, very blessed. I agree. My great-grandfather, they lived in Pittsburgh. He was a German immigrant, and remember, there's a strong history in Germany, interestingly enough, of plant-based eating, of healthy living, especially the work of Father Kneipp, this German priest who kind of cured himself of tuberculosis with kind of cold water immersion therapies and fruits and vegetables. And they had all of these facilities and clinics around Germany where people would go to stay to reverse common diseases through food. So my great-grandfather had heard about this years before. And when he was now living in Pittsburgh and having health issues, he began to eat fruits and vegetables and do a little therapeutic water fasting and exercise, and moved his family outside the city so they could have fresh air and all of these sort of simple, basic health premises. So my grandfather learned from that. My grandfather ended up going to the New York College of Naturopathy and in New York City at the time, and being trained as a naturopath and a chiropractor. And then he went on to open up Esser's Ranch, which was around for well over 65 years. Where he supervised people, therapeutic water fasting, juice detoxes, healthy living. So I had the honor and the pleasure and blessing of living with my grandfather my whole life. It was a 3-generation family in one home. And then growing up at the ranch, this 10-acre mango farm in South Florida with, just growing up, eating fresh fruits and vegetables and exercising and playing. And it was amazing, absolutely. And obviously radically influenced my life and my career choices. So how can I not experience that and want to share that message, with the rest of my life with people?
That is super incredible and amazing. And not that I can mold my son to be anybody other than himself, but I truly hope that he grows up to be a plant pusher in the best way, in the
That's
very
right.
best way, and educating people. He listens to all my podcasts, and he's like, welcome to the Urban Pharmacy Podcast. Like, and he knows all the doctors, like he knows you. It's amazing. Okay.
I love
So,
it.
wow, that's just incredible. And you send the best message. You are such a bright light, and you are a professional in so many ways. Just tell us quickly what you do on a daily basis, aside from these juice retreats that I know you do. Can you touch on that too?
Well, right now I'm very blessed to have a lot of exciting things that I get to be part of. The last 6 years, well, actually the last 10 years, I've been private practice here in Ponte Vedra Beach, Florida, working with non-operative orthopedics. So doing a lot of sports medicine along with lifestyle medicine. So I do cool stuff like stem cells and platelet-rich plasma injections and standard musculoskeletal evaluations. But I incorporate lifestyle medicine, plant-based nutrition into that. I do healthy living talks around this city and nationally, as well as a lot of stuff online, as you suggested. Now, in addition to that, I'm the team physician for the University of North Florida, all the varsity athletics, which is a D1 school. And then I teach residents. So I have medical residents and sports fellows every day, doctors in training with me, with my goal to transform their lives so they go out and transform more people's lives. So teaching about plant-based nutrition, about motivational interviewing, incorporating it into their practice. So I get to do all those fun things. And then in addition, we host, my wife and I, a juice bungalow here in Ponte Vedra Beach, Florida, a couple minutes from the beach, where people can come and stay, get away from the world, get away from the toxicity and the craziness, get fresh squeezed organic juice every 3 hours, a lot of fresh, clean water, sleep, massages, and really just rejuvenate, let their body do what it's meant to do, which is to heal. And so I'm richly blessed, and it's so much fun to be part of people's health journey on every level and in different places. And I'm so excited to be alive and to be able to be part of people's lives in a good way, hopefully.
Oh my gosh, you're making such an amazing impact. It's seriously so inspirational. Okay, so living in the world that we're living in right now, we're sicker than ever. And we are in September as of right now, September 2021, going into the next flu season, which is probably going to be a doozy. So I want to ask you, Stephan, like where can we start in this day and age? What are some of your top tips to get going on boosting our immune systems? Which, I mean, we could probably go on for literal hours on, but like, what are the top foundational things that you see with your patients and with the people that you touch on a daily basis that we can change now that are going to make the biggest impact for our health?
Great question. I'd say there are probably 6 major ones to think about. But the reality is every person has to decide which one they're willing to start with. It's kind of like when people say to me, what's the best exercise for me, Dr. Esser? I say, what are you willing to do? And then we start there. And so when I think about the basic premises of health, those pillars of health really are nutrition or food, right? Movement or exercise, sleep, emotional poise, right? Avoidance of toxins and sunlight. And if you just break it down in those 6 elements, and then you say, where am I willing to start? A lot of people unfortunately get sucked into shamanism and they're looking for like a quick fix or something out of a box bag, out of a pill bottle, etc. But the reality is what you do with your fingers and forks are some of the most powerful predictors of your immune health for this coming season as well as for years to come. So certainly, if I had one place to tell people to start, it would be nutrition, because I think that is the bedrock of our health. But the other place I might pick out of there that some people wouldn't is actually sleep, which is so inherently essential, because during sleep, our bodies recover, our bodies renew, right? Our bodies debride and get rid of garbage, et cetera. I mean, it's just so crucial to remember that you need those 6 to 12 hours of sleep per night, depending upon where you are age-wise and how active you've been, in order to recover fully and really to be the healthiest you.
Okay, so let's break those down a little bit. Nutrition. Where do we start with standard American diet, going to a more optimal way of eating? Where can people get going?
Yeah, I'd say the first thing to do is to say more. more of the bright, colorful, fresh rainbow foods. Stop pitting people in the places of, I'm either part of a cult or I'm not part of a cult, right? But rather, it's the idea of, I'm going to eat more. I'm going to eat more of the good stuff, right? So sure, of course, I want everybody to go online, download my 4-week detox, do it 100%, clean up aggressively and move forward. But not everybody's ready for that. And I recognize that. So what I want to encourage your viewers who might not be ready for 100% jump in the cold water is to actually get more. So in other words, hey, instead of 2 scoops of Haagen-Dazs ice cream and 5 blueberries on top, let's go with a pint of blueberries and a tiny little bit of Haagen-Dazs ice cream on top. Ideally, I don't want any of the Haagen-Dazs. I just want the nice cream out of bananas. But I want to start where you're willing to start. I'm going to take your hand. I want you to start walking down the path. So if you're ready, if you hear the message and you recognize the best thing for my health, the best thing for animal health, the best thing for the planet is for me to go 100% plant-based, whole food, minimally processed, SOS type food. Let's do it. Let's go. We got this. Let's run together down the path. Yeah. But if you're not there yet and you're like, oh, my food addiction's too great. I'm struggling emotionally, psychologically. I'm struggling with food preparation. I'm struggling with support. Well, then let's start somewhere. And so, I pulled this over here, right? Heck, take an apple, eat it. Let's start there. Let's go, right? Every decision that you make is so powerful, and people forget this. They think it's got to be this huge radical transformation, but it's every step. Grab some blueberries, eat them, put them in your mouth, eat them, and let's move forward. And every time you're doing that, you're giving information to your cells that is either turning on disease, turning it off, up-regulated inflammation, down-regulated. You are modifying your body with every bite. That's what's cool. And so my recommendation to people is start where you're willing and let's move forward. And stop looking behind to where you said, oh, I can't do that. I never was able to. I'm too blank. I'm too this. I'm too that. I'm too old. I'm too young. I'm too sick. I'm too fat. I'm too poor. I'm too busy. No, you're not. You're only those things if you say you are. And so now is the day to say, I value my health. I value me. I am worthy of health and I want to be healthy. And then let's go down that path together.
Yeah. I love that. And I love how you talked about, well, first off, SOS free, guys. It means salt, oil, sugar free. We've talked about this on the podcast with multiple other professionals. They're addicting. They're so addicting. So if we can just at least start cutting those out, which is, they're really attached to processed foods, and we really crowd out with the micronutrients, which I know you teach on so much, of the fruits and the vegetables, our body is going to start craving that, and we have to send those messages. So I really like that. I like that visual of putting the entire bowl full of blueberries, just a little bit of that ice cream if you need to get that dopamine hit, and just start, decreasing it on a daily basis. Now, can you talk about what we're eating, animal heavy foods and processed foods, just briefly, why they are contributing to a decrease in our immunity, cellularly? What are these foods doing to us, depleting us? How is this happening?
So I'd think about 4 or 5 different ways in which these food-like substances of addiction, we might call them, as well as these foods derived from animals, have a negative effect on our body. So number one, let's just start with basic inflammation. So the foods that are heavily processed and the foods derived from animals upregulate inflammation in the body, whether it be due to the rapid spikes in blood sugars that occur from a result of, let's say, the processed sugars, processed flours, and the like, whether it be from insulin insensitivity, meaning that your body's unable to use its insulin and blood sugars well. That would be from the high fat, high saturated fat, meat-based foods, or whether it be from arachidonic acid, which is a parent molecule for prostaglandins. Let's break all that down, right? So the idea being the following: your immune system is like a well-trained military that should be competent and ready to respond the moment the alarm goes off. Everybody's ready. They're running down. They're ready because the bad people are attacking, right? And they're ready to protect your body. But if you compromise your immunity, now you've got people who are sleeping on the job. You've got people who are kind of dealing with, they're in the bathroom again with their upset stomach, right? They're not ready to actually go to battle for you. They're dealing with a lot of other garbage and junk. That's a very simplistic, concept there. But so studies, for example, show us that increasing the consumption of refined sugar impairs the function of your neutrophils, which are your white blood cells, to burst and release hydrogen peroxide, which is what they do to engulf and break down sort of bacteria and viruses. And so as a result, if you eat these high sugar foods for multiple hours afterwards, your immune system is impaired. It's unable to do its job. And so the great example of that would be the little child who comes home with a sore throat from school, and the well-intentioned parent takes them to Dairy Queen to have a cold something to eat on the back of their throat. And without realizing it, impairs the immunity of the child further, so the disease process progresses more rapidly. So compare that to, for example, how I was raised, where you started to get a little bit of a sore throat. It was immediately, okay, we're shutting you down, you're sleeping, you're drinking water, and that's it.
Yeah.
It's like, wow. And so the studies show us, for example, on therapeutic fasting, that after a couple hours of fasting, immediately neutrophil function increases and enhances. In addition, lymphocytes, right, which are these T cells in your body that are about fighting viruses, et cetera, they immediately, what we call demarginate, meaning they come off the periphery of your blood vessels and they come out of your bone marrow in search of the bad guys. And so that's what occurs. So when you put your body into that state of brief therapeutic fasting, immediately you upregulate the immune system. Let's not forget, too, that the consumption of food, especially calorie-dense, micronutrient-poor foods, is a lot of work on the body. People get in this bad habit of thinking of just calories in. They never are thinking about, well, how many calories does this take to break this down, right? What's the trade-off here? Mm-hmm. So foods that are heavily processed, foods that are all the meats and the dairy, et cetera, these foods are heavy on the body. They take a lot of work at the level of the kidneys, at the level of the liver to break down, especially the animal-based foods. The refined foods, they're more rapidly absorbed into the bloodstream, but they have a lot of negative effects because they act almost in a drug-like fashion with impairing immunity. So the second thing I said was inflammation. And so all the studies are clear on this, is that when we consume more animal-based foods, they increase inflammation at the cellular level. And they do nothing to reduce inflammation. Again, the risk-benefit relationship. Versus fruits and vegetables, right? You cut that apple, it turns brown. Why? Because it's oxidizing. It is absorbing inflammation. So when you eat that live, fresh food, you are absorbing your own inflammation in the body. Now, I mentioned two big words, arachidonic acid and prostaglandins. Well, everybody in America just about knows about this, but they don't know about it. They know about it because arachidonic acid is a parent molecule that's broken down to form prostaglandins. And prostaglandins are molecules that go in your bloodstream and damage your tissues. They cause pain. So a woman's period, why? Well, because prostaglandins are pissing off her uterus. People have osteoarthritis in their joints. Why? Prostaglandins in that level. And so when you take an ibuprofen, Motrin, Aleve, naproxen, that's blocking the conversion of arachidonic acid to prostaglandins. You're blocking that chemical pathway. But do you know the number one source of arachidonic acid in the human diet is all meat and dairy and fried foods? It's not broccoli, it's not blueberries, right? They don't have that. And so the reality is, if you're consuming lots of meat-based foods, you're increasing the production of arachidonic acid in your body. And as a result, you're increasing the likelihood of prostaglandin production and pain. So that's why people find when they consume more bright, colorful, fresh fruits and vegetables, on average, their joint pain decreases, as well as sinus inflammation and chronic congestion, all of which are part of immune function.
Yes. Oh my gosh. Okay. Fascinating. All right. So plants win. Now let's talk about micronutrients, because you mentioned that briefly. I know that you eat largely raw. Can we just talk really quickly about optimizing our micronutrient absorption? Are you looking at, whole raw plant foods, fruits and veggies, or are we thinking about juicing? Do you ever think about eating the cruciferous vegetables raw versus cooked for maximum micronutrient absorption? Do you have a rule that you follow, or is it really just largely for the people that are listening, let's just get them in?
Yeah. I'm a simple guy. I've got life to live. You know what I mean? I don't have time to sit around and count exactly what percentage of that and percentage of that and what. So if you like doing that, I say to people, you want to do that, knock yourselves out. Yeah. But the reality is, if you are eating large quantities of minimally processed whole plant-based foods, and that's all you're eating, especially, right? So long as you're getting adequate total caloric intake, I don't think you need to be worried about the rest. Stop worrying about all the other little details. So a lot of people, unfortunately, they start looking at the forest and then they get focused on the trees too quickly, right? So I think the key is first, if you're serious about this, eat nothing but plant-based foods, whole, minimally processed, etc. You cook them a little bit, don't cook them a little bit, 80% raw, right? 20% cooked, ideally, in my mind. But other than that, eat for what your caloric needs are with a micronutrient density that's appropriate for general health, and then see where you are in 6 months.
Okay.
And in 6 months after that, make another evaluation, right? So, there might be times in your life where you're going, ooh, I'm falling away from the greens. I'm not getting enough greens. Let's get more greens in, right? Mm-hmm. So on and so forth. But I think the key first place, because what I don't want people to do is start being like, oh, wait, there's this detail and that, and I have to be careful the percentage of that and how many cooked, and it's like all of a sudden they get overwhelmed. They're like, I may as well just go eat, McDonald's, right? Because I see that all the time with people. Back in the old days, right, when I was growing up, it was all the food combining stuff, right? Can't have acid with alkaline, can't have this with that. And before you knew it, people were like, this is too much work, I'm out. And so I don't want people to be like, oh, am I getting enough omega-3s here? Am I getting enough this here? What about my thiocyanate that? What about this? Right. And it's like, oh my gosh, right? So for the higher level people, absolutely. You've been doing this for 2, 3, 5 years. Well, now let's get a little bit more into the bushes, into the details of all this stuff. But at the heart of it, we want you just loading up your body with micronutrient dense foods, in huge quantities, and move forward from there with as little kind of processed added junk as possible.
Yeah. Okay. So good. I'm really glad you said that, because people do get so caught up in they overanalyze the little things and then just lose the entire sight of like the bird's eye view of healthful living, healthful eating, at least. I know that the eating is so, touchy. And omega-3s, you guys, can even be found in like iceberg lettuce. So they're everywhere. We just need to eat, we'd have to eat like 50 heads of it, but still, we're stressing out too much on the little things. Okay. So let's go to the next pillar. You said sleep. 6 to 12 hours, depending on how, much or how old we are, etc., how active, all the things. Anything else that you suggest in terms of really maximizing that sleep? Do you suggest eating early for our circadian rhythm? Like, how do we maximize sleep?
I think the first thing is to be aware. And very few of us are aware of our sleep. We just know, I guess I'm gonna lay down now, I'm kind of tired, and we don't plan our sleep. We don't think about our sleep. We don't evaluate how we feel in the morning, except for that morning. We go, oh, I feel horrible. Right? What it should be is you wake up and you say, how am I feeling? Was that enough sleep for me? Did I wake rested? Was that okay? No, it wasn't. Okay. Do I need a nap? Yes, no. Okay. Do I need to get to bed earlier? What did I do that didn't work out well? So sitting there and watching, Thrones on Netflix until 2 a.m. in the morning, et cetera, not a good choice. That is not prioritizing your health. Just like if you went to Mickey D's is not prioritizing your health. So it's crucial to remember sleep is absolutely essential for your health. And so the first thing is awareness. If you're waking up and you're downing some sort of caffeinated beverage to get you started, that's a problem. You may have not gotten enough sleep. Do it once here or there, fine. But if you're waking up and having to drink multiple glasses of something, es no bueno. That's not good. We don't want that. So what I recommend is first awareness of your sleep. And if you notice that you're not that energetic, vivacious self and you're dragging, okay, well, maybe you need to get a little more sleep. Now go back to sleep hygiene, right? Which says, the bedroom is for sleep and sex only, not for watching movie and reading books, right? We get into the bed, within 30, 40 minutes prior to bedtime. We don't want, no caffeine, after like 2 p.m., no exercise after like 6 p.m. or within 3 hours of sleep, no eating within 2 hours of sleep, all these little basic, very simple premises that make a lot of sense. But we should be prioritizing our sleep. So if you're that person who can do anything, watch the horror film, do whatever, and lay down and you're out and you're, sleep for 8-10 hours, you wake up rested, knock it out. That's great. But if you're the person who tends to have a little reflux or a little sensitivity, or that, you're up all night fidgeting, you need to be serious about your sleep hygiene and your sleep habits. And if those things are inadequate, again, did you get some sunlight on your body during the day? Did you get the exercise? All these things increase sleep depth and performance. The next thing is to think about, do you need some supplementation? Do you need a little bit of magnesium? Do you need a little bit of, some, let's say a little lavender oil or things of that nature? These are all things to consider. But the first place to start, be aware, and then sleep hygiene.
Okay, and now I'm trying not to be an over-analyzer here of magnesium, but Dr. Esser, if there is a specific form of magnesium, is there a specific form that you recommend for people who are looking to relax to go to bed?
Well, I tend to like magnesium glycinate, but again, if there's something that you love, please share with us as well.
I'm still deciding. Kind of testing on myself, because I know there's like 4 main ones that you can take, and I'm creating a blog post on that right now. So I'm just trying to figure out what's the best. It's kind of hard to find solid information on that. So
that's right. It's more about stories and anecdotes, I think. But historically, for my patients, I tend to use some magnesium glycinate, which is a chelated form of magnesium, and to help them assist with sleep. But again, the other one that I like, as I mentioned, is Silexan, which is a lavender oil derived out of Germany. But again, even starting with some simple lavender oils, high quality essential oils, right on the temples and hands and little things like that. But again, to me, that's next level. That's not start there. That's next level. First, excellent sleep hygiene. Then if you need something, right? Because all of us also, don't forget, stress plays a huge part in our ability to sleep. And so if you're up ruminating about life and things and the environment and the world and this and your job and your spouse and oh my goodness, right? So you've got to make sure, sometimes you might need a little assistance with sleep. Is that going to be some spiritual reading? Is that going to be deep breathing and meditation? What is it? But we need to all make sure that we're maximizing those lifestyle interventions before going to agents, that are supplements or pharmacologic agents, et cetera.
Yeah, I love that. And guys, if you don't have like a good quality lavender essential oil, and you, for some reason, don't want to have it in your home for whatever reason, you can grab little lavender sachets. I know you would think to put these in like your drawer. If you're watching YouTube, you see me holding up a lavender sachet, but you can smell it and still get some really great therapeutic effects to calming your nervous system, and sniff it before you go to bed. So, okay, I love that. Lavender is ridiculously awesome. Okay, what was your next pillar? What was another pillar?
Movement or exercise. Yeah. I mean, that's the data on exercise is so compelling for the immune system. It increases neutrophil or white blood cell activity, right? Neutrophils and lymphocytes. It increases blood flow. In other words, it's opening up the blood vessels so that the white blood cells can get to where the infections are better. It dilates all of your capillary beds, because people don't recognize, and they forget this. If your roads are all shut down from a massive hurricane, the military can't get in there to fight the bad guys. So you've got to open back up the blood vessels. Well, nutrition, those nitric oxide rich foods, the nitrate rich foods, right? The beets and the berries and the greens, right? They dilate the blood vessels. So once the blood vessels are open, now you need to get the military through. And when you exercise, you increase short-term, right? Your cardiovascular output, your heart rate, et cetera. And so everybody's out to the periphery. They're getting into the mucosa better. They're getting to the brain and the skin and the tissues. And so we want the immune system to be getting there well and effectively. So exercise is so powerful for improving blood flow, mobilizing your white blood cells, also mobilizing mucus. Remember, your body forms mucus to engulf bacteria and viruses in your lungs and your nose, et cetera. So when you're exercising, your lungs are going, right? And that's getting all of the blood flow in there, and it's mobilizing the mucus so you can cough it up, get it out, snort it out, whatever, with all of the bacteria and viruses that might be in it. But so all of this is so essential. Oxygen, of course, don't forget, is toxic to viruses. They hate it. And bacteria hate oxygen. So that's why that respirations, big respirations that come with exercise, are so powerful to reduce your risk of upper respiratory illness. And so we want to be getting that strength training exercise, but also cardiovascular on a regular basis, ideally 150 to 300 minutes a week of some form of cardiovascular activity, even if that's just jogging in place for 10 minutes, right, while you're waiting for your oatmeal to be fully done, right, or going out and biking and cycling and swimming and all the rest. But the reality is movement is medicine. So you want to get it a little bit in every day throughout your day, where and when possible. You have to artificially create movement in our society, right? Because everything is so industrialized and controlled. So if you don't if you're not out there working a physical job, you've got to intentionally get up from your desk, do, quick 20 squats, do a quick 20 push-ups off your desk, stretch out side to side, jog in place for a minute and a half, and then you're back to work. Yep. Right. Yep. But even that is powerful medicine. And so every day, in every way, each of us needs to be moving.
Yeah. Yeah. And that just brings, me to the point of why we should buy the pineapple farm in Kauai, so that we can, be out there planting and, moving on a daily basis.
I like it.
Just another reiteration there. Okay. So we have 3 more pillars. What was it with poise that you said?
That's right. Emotional poise. Right?
Emotional poise.
Yeah, this is a classic stress reduction concept, right? So, but being emotionally poised, in other words, when that crazy stuff happens to you, which is going to happen every day, something, right, is going to stress you out a little bit. The guy cut you off in traffic. The person at work was blank. Your grandma called you and talked about whatever. I mean, who knows? But something is going to happen that's going to cause, quote, emotional stress. You and I need to be at that place that we're emotionally poised. Right? Kind of we're able to rock a moment and then come right back, not suddenly fall off the pillar, go crazy, right? And immediately we're going hunting junk food out of the closet in the pantry. And then we're, blah, 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 I can't handle this. And da, 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 life is just, and we all know how that works, right? It's this out of control spiral. So it's important to think about, can you come back? I've suddenly had a visual in my head of, remember those little blow up toys that, you used to see in the stores that would be, you'd hit it and it would kind of pop right back up, right? Our emotional poise should be such that we have a nice foundation that's robust, that even when we go, whoa, well, we come right back. We're okay. It's all right. Versus kind of splat on the floor and, water everywhere. And so you want to develop this, because many people think this is something you're born with or otherwise. The reality is your response to emotional challenges and stressors is in your control. And it's a habitual response. And you can change the neural network. But first, you have to be aware of your response. For me, for example, when I'm in a stressful situation, all of a sudden my heart rate starts going up and I start taking more shallow breaths and I just feel not well. And I'm like, what the heck are you doing? This is not helping anything. So I'm trying to get in my mind into the place where I can say, hey, you don't have to act like you're a 5-year-old boy who's in trouble. Take a breath, evaluate, did you do something wrong? Yes or no? Now breathe again. Evaluate the situation in more of a rational response, right? Or if I'm having conflict in my marriage or with my children or with outside people, wait a second, what are my real goals in this moment, right? Pause, be present, breathe deeply, and then come back. So whatever it takes for you to start being more aware. And then I think there's value. Some of us really need some more intentional work, and that might be something like a cognitive behavioral therapy workbook, right? There's some great ones on Amazon that you can get for 7-week cognitive behavioral therapy workbooks. I encourage people to get them, use them for that 7-week period, see if it's assisting you, see if it helps you, right? For many of us, having a foundation in a spiritual or religious belief system is very powerful innately, to believe in a higher power, right? That you have greater value and purpose in life, etc. Each of us need to find that grounding place in which we can come from to then find balance, to find poise. So absolutely essential, because otherwise, you're kind of just like a leaf being blown around constantly, right? With the emotion this way and the emotion that way. And oh my goodness, and this is happening in the world. And it's like, whoa, stop, come back. Yeah. I was thinking about it before our talk. I'm not sure why it was coming in my head, but in the old days, right, you used to have these films on television, and most of what you watched on average was well-balanced families, happy people talking, blah, blah. And they said, oh, well, that's not reality. And it was interesting because actually, for a lot of people, it was reality. And now we're watching the Kardashians, right, on TV and all this. And it's like, now we're saying, well, that's reality. And people are almost modeling their lives off of what they see. And so what you and I need to stop, and we need to say, wait, how do I want to model my life? Do I want a dysfunctional family unit? Do I want a dysfunctional life? Do I want a dysfunctional job situation, right? People watch The Office, right? And et cetera. Well, are they modeling that in their workspace, right? So even though the humor is evident and apparent, the reality is, well, that's not what we should try to create. We should actually be trying to create cohesive relationships, positive things, encounters that engage, uplift, and empathetically support. But all too often, I think we've now grown up in a populace, or people have more recently, in which that's normalized behavior, and now they put it into their own lives. Yeah. So I tell people, be very careful what you put in here.
100%.
Because it radically influences how you live your life. So actually, for me, there's no television in my house. Same. We've got computers, but are very careful with what we put in, that goes into our brains. Because I know for me, I'm very easily influenced. So if I watch that, oh my gosh, I get all worked up and instead of if I watch uplifting, positive things, if I'm out in nature, if I'm goal oriented, right? I'm far more likely to be in a positive headspace. So again, what did I say earlier about food? Same thing with exercise, awareness. Mm-hmm. It's so easy for many of your viewers, for all of us. What happens is you're in the midst of life and it's chaotic and it's crazy and you feel overwhelmed and then you're just reactionary. Yeah. Instead of flying to the 30,000 foot view of your life, looking down and saying, how's it doing? No, that's not working out well. That's not going to set you up for success, Brenda. I need to change that. All right. Well, Paula, whoa, I didn't realize that was happening. Okay, I need to change that. But we've got to get to that place. So maybe that's getting away from your life for a day or two somewhere, but not going just to kind of luxuriate and sit watching TV. No, to actually be thinking. How am I doing nutritionally? How am I doing exercise-wise? How am I doing sleep-wise? How am I doing emotionally? And actually developing a plan for your health. Yeah. So maybe that's coming to Esser's Ranch Juice Bungalow. Yeah. It's funny. Yeah. We actually have a curriculum for people while they're with us, which is doing that, breaking down their life a little bit and saying, I need to create a coherent plan for my health. Yes. So it's not just this out of control moment constantly. I've got to get things in a place where they are leading in a direction that I actually want them to go. Yes. Yeah.
And bringing it back to the TV, we still have our TVs. I do turn it on every now and then, but guess what it is? It's only for Little House on the Prairie. And I love it. That brings me back to what you were just saying, like the family, that cohesiveness. I want my son to learn that. So if we're going to turn the TV on, we're watching Little House on the Prairie.
I love it. Oh, absolutely. As you should. You should be indoctrinating him with healthy behaviors and healthy foundations as much as possible. I love it.
And we need to think about that environment, which I know that you are so, that you teach so much about too, like the news. Like we're talking about immune health on this episode right now, guys. Like the news that we're watching, the fear that's always in us. We're living that reactionary state. We're not able to be proactive in our health when we're always having that fed into us subconsciously. Even if you're cleaning your house and the news is on and you think that you're not like watching it, it is going in and it is not serving your immune system. It is depleting your health. And we need to unplug and go to Dr. Esser's Ranch. Okay.
Yeah, I mean, and that stuff breaks my heart, like you were just commenting on the news and all the COVID stuff, because the reality is, right, for 90+% of people in our society today, it is a non-entity, it is non-event. And, and yet the hype, the media, et cetera, that is just creating panic and fear and anxiety for people and has continued. And as you suggested, that suppresses immune function and it paralyzes people to even make healthy decisions and makes people begin to think that what they do doesn't matter, which is absolutely unscientific. Because as you may have seen, right, is that when you look, eating this plant-based approach, getting regular exercise radically reduces statistically your risk of the common diseases like heart disease, diabetes, et cetera, but also of uncommon diseases like the flu, H1N1, and COVID-19. The data is compelling on that, showing that 74% reduction in severe COVID-19 in people who are fully plant-based. I mean, it's just, the data is all there to support us. And it's crucial that we recognize that what people say in the media is not always the truth and not always accurate.
Yeah. So, Good. Okay. So as we're talking about viruses, I want to ask you this. Can you please tell us about, as we're going into the flu season, what you think about the flu shot?
So number one, I tell everybody they should make an informed decision based on risk benefit for themselves about whether to get any vaccination of any kind. Right? That's a very personal decision, and I think you should make that decision. We should all have the right and freedom to make that decision. Number two, as far as for myself, my decision with regards to the flu shot has been and will continue to be that I will not be vaccinated for a disease process that I have extremely low risk of. Mm-hmm. So the flu for me is going to be a non-event. Me getting vaccinated will not reduce my risk of spreading it to anyone else. Thus, there is zero benefit to me and all risk. So you want to remember all medications, all interventions, all nutritional interventions as well have risk-benefit relationships. So when you get vaccinated for the flu, you are essentially saying the risk of the flu is higher for me than the benefit of the injection is higher than the risk. So for me, as a mid 40-year-old, slender, plant-based eater, exerciser, guy who gets sleep, my risk of the flu being a significant event is minimal to none, right? Less than probably 2%, 1%. Number one. So from a scientific statistical perspective, no benefit to me. Then I take on all the risk. So you want to remember that anytime you get a vaccination, it comes with a specific risk. So for example, you get a vaccination for the flu, it can increase your autoimmune responses, right? Your allergic responses, because you're putting a chemical into your body. The body responds to it in a way that says, whoa, this is not normal. Let me create an immune response and then attack it. But every time that occurs, it can also begin to attack your body incorrectly. So for example, when I worked at Harvard doing my residency, every flu season, we'd see kids coming in with increased rates of Guillain-Barré. Guillain-Barré is an autoimmune disease in which the body attacks its own nervous system, and the child begins to get an ascending paralysis, an inability to walk, difficulty breathing, and they get put on a ventilator. Every year we would have kids with that. Some would completely recover, others would not. And the rest of their life, they'd be disabled because they got a flu shot. What the heck? Why are we vaccinating kids when the risk is almost nil to those children? So this is a problem. We need to look at the science and the actual data. So the Cochrane meta-analysis, which is a group that does evaluations of medical interventions, says that for the average free living American, and really in the Western world, the risk and the benefit of the flu vaccine is such that most people do not need it and shouldn't get it. If you are over the age of 65, or if you live in a group home, like a nursing home or nursing facility, there may be some benefit, according to Cochrane meta-analysis. But this is the most standard of care, straightforward. That is their international recommendation based on the science that exists. So for the average person who's a sick 45-year-old, 32-year-old, 28-year-old, whatever, walking around outside, otherwise healthy, there's not a huge benefit. Don't forget the following too. The flu vaccine is based upon what were the strains last year or the year before. It is not based on what's around now. And so depending upon the year, if you look at CDC data, the flu vaccine can be anywhere from 30 to 70% effective, meaning it's not even that effective. So for you to get the flu vaccine, not get benefit, just get risk, makes zero sense. So for me, I'm out, I'm not in, and I would tell people to make their own informed decisions based upon their personal risk. Yeah.
Yes. And I remember learning that in physiology too, about like all the flu strains and how it's just like we can't ever know the year in which what strain it's going to be, and it's just based on past, and it's like a literal needle in a haystack. So it's just kind of like
that's right. I mean, I think, and again, that's the same thing what we're seeing like with the COVID vaccine for kids, right? So in 2020 to 2021, only 385 children died of COVID, and of those were all seriously ill kids with major medical problems, et cetera, on average. So that's out of 50 million children in America, 385 died supposedly of COVID. So the risk-benefit relationship certainly does not fall in favor of vaccinating children for COVID. There is no scientific data to support that. And that is clearly kind of what even the international organizations would say as well. So as far as kind of for adults, again, people need to make their own informed decision based upon their risk-benefit relationship.
Okay, good. Thank you for that. All right. We have 2 more pillars, right? Have we touched on all of them?
There were 2 more. Yeah, the next one was sunlight. And so sunlight is so rejuvenating for multiple reasons. Number one, obviously, sunlight increases the production of vitamin D, which, as you know, is a potent antiviral immune regulator and so good for so many other things like depression and the rest. So we want that. Number 2 is that sunlight in our eyes helps to reset our circadian rhythms to help us to sleep when it is dark, when dusk comes on. So sunlight is crucial for those 2 major reasons. For us. And so you want to be able to get out there, ideally 15 to 20 minutes worth of sunlight on your arms, legs, back, and when the sun is above 45 degrees of the horizon, so you can create some vitamin D, right? We're not asking you to be out there and bake and burn and get all the skin cancers, but rather be out there 15, 20 minutes, get some good sun exposure in the eyes, on the arms, legs, and back, and get some good vitamin D production. So crucial to have that.
Yeah. So, and if people can't get that, do you recommend a blanket recommendation of vitamin D supplementation?
I do. I mean, first I say get tested, test, don't guess, right? So get your vitamin D tested. Good morning. I see you there.
Yeah.
My son good morning. Good morning.
My son has woken
Hello.
up. I didn't know if you'd bring your oatmeal in here or not.
I love it.
This is Dr. Esser. We're talking about.
Hi. So I tell people I get tested first. If your vitamin D is below 40 or so, then it's probably worth repleting. If it's up there in the 50s and the 60s, there's no value to you repleting with more vitamin D. So test, don't guess. So test it. And if it is low, yes, replete it. I think as a strict plant-based eater, it's worthwhile to replete your vitamin D, whether it be 2,000 to 4,000 international units per day, and then get it retested in 6 months and see where you are, and see if that was adequate for absorption and for you.
Yes. Okay. Love it. All right. Dr. Esser, what is the last pillar for immune health? Oh, wait. Yeah.
The last one. Yeah.
The last one. What is it?
Last one. I was going to say avoid toxins.
Yes.
So in those, those come as the obvious toxins, the excessive alcohols, the nicotines, and all the street drugs, of course, but also the less talked about toxins, right? Especially, let's say, for ladies wearing large quantities of makeup and mascara and all the rest, or gentlemen and ladies kind of wearing underarm deodorants and things like that, remembering that your skin is a potent organ of detoxification, but it's also an organ of absorption. And so when you put stuff on it, it ends up getting in it. So this is everything from the baby skincare products for our young ones to our perfumes and deodorants, to our facial products, to our soaps, to our hair care products. I mean, all these as much as possible, where possible, using simple, minimally processed, organic, plant-based, so on and so forth, without all of the polycarbon, the blah, blah, blahs, and this, that, and the others you can't even read, trying to reduce that exposure. I mean, starting, for example, in Florida here, right, if you're going to be wearing your kind of topicals to avoid sun, all the sunscreens, trying to go the zinc oxides, right, rather than with the chemical based, wearing long sleeves instead of kind of short sleeves after you've gotten your sun exposure, right? But if you're gonna be out there for 3 or 4 hours working in the garden or exercising, rather have on that long rash guard, right, that protects in a hat, and then take it all off and get your 15, 20 minutes of sun rather than 3 or 4 hours, kind of thing. So so essential. Do you have any brands that you're a big fan of, that you're a supporter of for, products that you like?
Yeah, well, I teach people. I've been working with a particular brand, but there are so many brands that I could recommend. I'm linked with and have been working with Beauty Counter for over 6 years. They're based out of Santa Monica, California, and they basically took the European Union standards and have exceeded them for known carcinogens, hormone disruptors, allergy-causing ingredients that we don't want to be putting on our skin. So in terms of like sunscreen, I would say definitely Beauty Counter. You want to be looking for a non-nano zinc. I mean, we want to be looking for mineral-based sunscreens, not chemical-based sunscreens. Not only are they destroying our bodies, but also the coral reef. And I would go to the Environmental Working Group app. This is my recommendation in terms of products in your home, cleaning products and your personal care products. Go to the ewg.org website, or you can download an app called the Healthy Living app, and it will give you a rating from 1 to 10 on the toxin load of your body. And you want to stay at least below a 3 in terms of your personal care and what you're putting on and in your body and bringing in your home, and even the cleaning products that you're using. So that is where I would start. I think that's a really great tool. And we need to be thinking about this, because every single time we're putting these toxins on our body, it's just depleting our immune system. That's what we're talking about here today, and how to optimize that. And I'm really glad that you bring it up, because it's so important. And they're also in our food. Pesticides, the antibiotics that are given to the animals. We have to be thinking about environmental toxins on a daily basis, because we're like bombarded with them. So
right.
Yeah. Thank you for asking. Okay, Dr. Esser, we're wrapping up. I have 2 more questions, because I really want to know, what does your morning routine look like?
My morning routine is hop up out of bed, spend a little time in prayer and reflection, do some exercises, and then make smoothies and oatmeal and food for all the kiddos and wife, etc. and then quickly shave, get dressed, and zip off to work.
Got it.
So that's my routine right now.
You're starting with gratitude, which is, I think, super imperative, and prayer. Okay. And then I always ask all of my guests this: what does holistic living mean to you?
Holistic living to me means a style of living in which, I don't know, I'm going to make my own of it, but in which everything is kind of synergistic. Everything's working together. Everything is, the thoughts, the words, the emotions, the actions, the behaviors all kind of fall in place together to create kind of a beautiful circle that works together, rather than parts working against each other, one part compromising the other, right? And instead, all of them working together to create a kind of a vital, energetic, beautiful, kind of healthy life. Yeah. And without, harming those around. Every morning I wake up and I say, nobody has to die for me today, which is kind of cool. No animal had to die for me today. And, in the same way, to try to live emotionally and psychologically with gentility with our other humans in the world as well, that we're living that holistic life that, that's one of growth, one of health and vitality, and, giving back where we can.
Love it. Synergistic living. So good. Okay, my friend, thank you so much. I literally have so many questions that I want to ask you, but this was great. I think people are going to definitely find value. And I hope that you as a listener can take steps today to become more healthful. Take that approach, listen to these 6 tips that Dr. Esser gave us, and pick one and just start today. Even if it's just eating more apples or putting more blueberries in your bowl, it can make a massive, massive difference. Or pineapple or apples and all the things. So yes, go fruit, go plants. Oh, let's take a picture actually. All right, well, be well. We will see you on the flip side, and take care. Hold on.